Hi everyone, good to see you. Justin Jolene here, and I'm excited to share with you the running shoe reference guide. In this evidence-based guide, we'll go over 11 of the most common running shoes used by recreational runners. And really the aim of this guide is to help clinicians to be able to select appropriate running shoes based on gait presentations, injuries and diagnoses, and their clinical relevance. Now, while each shoe has pros and cons to them, it's really important for the practitioner to be able to assess the entire patient's clinical presentation before recommending a pair of shoes. So without further ado, let's get into the running shoe reference guide. So the first shoe I'd like to go over is the Asics Gel Kayano 30. Now this shoe, and as you can see here, I have the shoe type or what makes up the shoe, the gait presentation, and then also diagnoses and pros and cons. So really we're going over the shoe specific technical data. We're going over what gait presentations would be beneficial for this particular shoe. Also what diagnoses would be good for this shoe as well, and some of the pros and cons to them. Now, at the very bottom of this guide, you'll find that there's a whole bunch of research articles. There's also some information there about where we got some of the data and technical info. So please look at that. That's a great resource if you really want to get into the technical weeds and look at some of the emerging research on running shoes. So as I mentioned, the Asics Gel Kayano 30. So this is going to be a max stability shoe. It's also going to have a moderate heel drop. So that's going to be 10 millimeters. Heel drops are considered moderate, really anywhere between 6 and 10, although this number is changing over time. And that's going to be a stack height in the back or the rear foot of 40 millimeters and in the forefoot of 30 millimeters. That's how we get our 10 millimeter heel drop. This is also, as I mentioned, going to have a high stack height. It's also going to have medial and lateral stability in the shoe. And it's going to have a decreased amount of medial posting. The Asics Gel Kayanos were shoes that traditionally had a very, very high arch in the sole. And so this has actually a decreased amount of that medial arch or medial posting. So appropriate gait presentations would be minimal to moderate heel strike. And that's primarily because we have a fairly high stack height. We also have a fairly high heel drop. It's on the moderate, kind of bordering on high heel drop there. This is also going to be appropriate for moderate pronation, especially since we have that medial support, and excessive supination at initial contact with that lateral stability. Genu-valgum and contralateral hip drop are also aspects that can be controlled here, primarily because they're going to be able to be stabilized from some of those stabilizing factors of the shoe. The diagnoses that would be appropriate for these shoes would be tibialis posterior tendinopathy, because it's going to help to put less pressure on that posterior tibialis when you're going to be doing that pronation motion or during initial contact. And then also a gastrocnemius strain, soleus strain, because you do have a fairly higher heel drop, and that's going to offload the pressure on those gastrocnemius and soleus muscles. And then also the control along with the heel drop as well is going to be suitable for patellar femoral pain syndrome and IT band syndrome. So what are some of the pros and cons of the shoe? Well, it has both medial and lateral support, which is great. That's going to lead to a more centered foot contact. And compared to the years past, the Asics Gel Kayanos were very, very medially driven, meaning they had a lot of medial support. Now with some of that lateral support, it's a little more centered. Now, it does lack some of the medial support for those high arches. So if your patient is someone that maybe has a very high arch and plantar fasciitis, for example, this may not be the shoe for them now based on their clinical presentation. And it is a fairly high cushion shoe. And then lastly, this does provide some of that support for medial collapse of the lower extremities, which is a great tool, especially if that's something your patient is presenting with and that's an appropriate use of a max stability shoe. While max stability shoes do add more pressure and impact through the lower extremities, that can help some patients. Staying in the Asics brand, we are going to move on to the Asics Gel Kayanos. The Asics Gel Nimbus, and this is the 26 model. So these are going to be max cushion shoes, and they're also going to have a moderate heel drop at 8 millimeters. They're rear foot is going to be 41.5 and the forefoot 33.5. And they're going to have a heel rocker with a limited heel bevel. That heel bevel is basically the little taper, that little bit of angle at the very heel of the shoe. And you'll notice that some of these shoes have a bevel, meaning a little bit of an angle at the very back aspect of the heel. The reason for this is because that heel bevel helps to land on the ground and guide the foot towards the midfoot. Same with the heel rocker. The heel rocker is going to be a rounded piece of rubber on the sole, and that rounded piece is going to guide the patient from that heel to their midfoot and forefoot, with the idea of getting a smoother transition of momentum from the heel to the toes. Appropriate gait presentations would be minimal to moderate heel strike, primarily because you do have a max cushion shoe, you do have a moderate amount of heel drop, and also because it is a fairly high stack height shoe. There's a lot of material between the base of the sole and the ground. So in this case, that could potentially promote early heel strike, as we can see in our pros and cons. So we want to be careful with how much heel strike that patient is doing, to be careful for the impact forces. We also would see minimal to moderate pronation would be appropriate here, with some of that heel rocker and heel bevel guiding the patient towards the midfoot. So it helps to get rid of some of that pronation potentially. And minimal to moderate supination at initial contact, because we are guiding that foot in that sagittal plane forward. However, we are still concerned. We don't have a lot of stability here. We do have a decent amount of cushion, so minimal to moderate is a little more appropriate here. Tibialis posterior tendinopathy would be appropriate, and peroneal tendinopathy would be appropriate for these shoes as well. As I mentioned before in the pros and cons, it does promote early heel strike, and that is primarily due to that heel bevel, and also it's going to be due to some of that stack height and some of the heel drop. These shoes do have a higher weight to them, which is a concern. That can be something that more people find cumbersome or painful, or potentially make different muscles work a little bit harder. And then it does have some improved toe box width. It is still a more narrow fit, but this has been improved since previous models. Staying once again in the Asics brand before we move on is the Asics Novablast 4. So this shoe is going to be max cushion. It's going to have a moderate heel drop, 8 millimeters, 41.5, 33.5 at the forefoot, a high stack height, as I mentioned before. This is also going to have a posterior heel flare, a heel bevel, and a rocker to it. And so what I mean here is there's a lot of material that's going to grab the patient's heel on the ground when they land. It also has a neutral shoe with a stiff midsole, meaning that the midsole is going to take a little bit of more work to be able to go through and to run through. Some gait presentations that are meaningful here would be minimal to moderate heel strike. Also minimal to moderate overstriding, primarily in this case because you do have that posterior heel flare, heel bevel. This is going to promote that early heel strike, and it might limit some of the overstriding these patients do. However, we have to be careful about the ground reaction forces that are going to go through our feet, especially if we are overstriding and landing early. That might add a lot of ground reaction forces through our body. Also minimal to moderate pronation and minimal to moderate supination at initial contact. One of the diagnoses, tibialis posterior tendinopathy, could be appropriate. And some of the pros and cons, it's going to be a early heel strike. It's also going to have an early heel strike because of the high stack height as well. And then that stiffness in the midsole can reduce the momentum from heel to toe, which can be of concern, especially when we see the stiffness of a shoe. The stiffness can cause us to work harder and to create more impact going up through our bodies. Okay, moving on to our next brand of Ghosts 16 by Brooks. This is going to be a neutral shoe with increased lateral and medial stability. It's also going to be a high heel drop shoe at 12 millimeters. We don't see many shoes getting up towards 12 millimeters these days, and that is certainly something that's important to see. Some patients might benefit from a really high heel drop, depending on their diagnosis, their gait presentation, and weighing the pros and cons, but it's an important thing to look at. And it's a high cushion shoe in the heel. It has a lot of cushion in the heel. The idea is to help absorb that impact through the heel. So gait presentation's minimal to moderate heel strike. We don't really want a lot of heel strike here because, unfortunately, with that high heel drop, it's going to really promote us landing on the heel. If we have an excessive amount of heel strike, we might have increased impact, especially pounding on the ground with that heel strike. Also, minimal pronation, because while we do have some aspects of stability, we don't have that much stability. This is not a stability shoe. And some minimal overstriding as well. Again, minimal because we do have a decent amount of heel drop. And again, we want to be careful with how much impact goes through our bodies here. Also, these shoes do have a limited heel bevel as well, which is also going to add to that promotion of a early heel strike, potentially. So some of the diagnoses we might see here would be appropriate, would be Achilles tendinopathy, and that would be because of the amount of heel drop. We're going to see that it's going to offload the Achilles, offload the gastrocnemius, the soleus, and it's also going to potentially be good for tibialis posterior tendinopathy because it's going to help to stabilize. It's also going to prevent us from getting to that dorsiflexion position, which is going to really tax the tibialis posterior. Now, that high heel drop and the pros and cons is going to shorten plantar flexors and decrease stress on Achilles tendons. However, we do want to think about the increased pressure on the heel at initial contact. We do have some medial and lateral stability, and these shoes are quite stable and durable as well. Okay, the Brooks Adrenaline GTS. So the Brooks Adrenaline, there's a lot of information on this shoe, and this is a very, very popular shoe. It's high stability. It's also going to be a high heel drop, 12 millimeters. Not a very high stack height, 24 millimeters in the back, 12 millimeters in the front. It's going to be a high heel cushion shoe, and it's also going to have a medial post to it as well. There's a minimal amount of posterior lateral heel bevel. And so some of the gait presentations that would be appropriate here would be a minimal to moderate heel strike. Minimal overstriding. Again, we're a little concerned with that high amount of heel drop and also just how much heel cushion there is. It could really cause us to pound more on the ground with our heels and increase the amount of overall impact going through our lower extremities. The moderate to excessive pronation would be suitable here, especially with the stability. And then excessive genu valgum and excessive contralateral hip drop would be indicated too. That high heel drop, again, is going to create Achilles tendinopathy friendly shoes. It's also going to be friendly to gastrocnemius strains and soleus strains, and again, tibialis posterior tendinopathy. As we mentioned before, it's going to shorten the plantar flexors and decrease stress on the Achilles. It's going to increase the pressure on the heel at initial contact. It's also going to increase stress to patellofemoral joints and the hip as well. Now, this is going to support medial collapse of the lower extremity, which is going to be important. But one important note here is going to be that all that support may actually cause more stress on the lower extremities as well. So support, helpful. However, support does come with the trade-off of adding a little more impact through our bodies. Going back to the fact that there's increased stress on the patellofemoral joint and hip, this is important because as we see, we're offloading the ankle and the Achilles. However, as we offload that pressure because they are shortened in any more neutral state or neutral place, that also is going to make it so that pressure goes up to the patellofemoral joint and also it's going to go up to the hips. So if there's issues or pathology going on there, we want to be very careful putting someone in a high heel drop shoe that's going to then be now putting increased pressure on the knee and hip. Hokas are very common with the running shoe market, and the Cliftons are one of their most popular shoes. Hoka has by and far created trends in the shoe market with max shoes, max cushion shoes. So let's talk about the Hokas themselves. They're going to be neutral shoes. They're also going to have a low heel drop of 2 millimeters. They're max cushion, and they have a rocker sole. So what would this cater to? A more midfoot, forefoot strike with that limited heel drop. And we're also going to see that it's going to be suitable for minimal pronation and minimal supination at initial contact. Primarily because they're neutral and primarily because we don't have a lot of support here. Also, having a limited amount of heel drop is going to make it so that you need more strength to be able to support yourself landing midfoot in forefoot. And that's going to make it so that you really need a lot of stability when you're running in these shoes. Many patients and many runners do not, unfortunately. Diagnoses suitable would be patellofemoral pain syndrome, granted that you have the strength and stability in the knees and the hips and the ankles to be able to support these shoes. Greater trochanteric pain syndrome, and IT band syndrome. Again, these are all things that are going to be offloading that knee, hip area, but putting more pressure and stress on the ankle and Achilles. So pros and cons: low heel drop relieves pressure on the calcaneus, also moderate amount of medial and lateral stability, and high cushion shoes are going to increase impact to the lower extremities, which we've said before, but we're going to have increased stress to the ankle and Achilles. So if you are a runner, or if your patient is a runner that would be suitable for that, this might be a good shoe for them. The Hoka's Arahis. Okay, so these shoes are, again, very, very popular. They are high stability. They're going to have a low heel drop of 5 millimeters, although it's inching towards moderate heel drop, a centered heel bevel, a rocker sole, and then we're also going to see medial stability along the sole with a very unique feature called the J-frame. The J-frame is, if you think of a J, it's going to be medial support along the entire sole, the medial aspect of the shoe, and then it's going to be a little bit of lateral support on the very lateral aspect of the heel. Gait presentations, mid and forefoot strike, especially with that 5 millimeter heel drop. We're also going to see some moderate to excessive pronation because these are stability shoes, even though they're going to be more midfoot or forefoot strikers that are going to benefit from this. Again, we want to make sure that they have enough strength, but this can help to give us some stability and to counteract some of the pronicity to pronate and supinate. Also, genivalgum and hip drop are going to be suitable for this. So as you would see, diagnoses would be patellofemoral pain syndrome, greater trochanteric pain syndrome, and IT band syndrome. Again, we are offloading the hip and knee and putting more pressure on our Achilles and our ankles. So we do have a good amount of medial stability with these shoes. We have some lateral stability too. We're going to have increased stress to the ankle and Achilles. We're going to decrease the stress on the knee and the hip, and we're going to offload or put less pressure on the calcaneus. New Balance, another very popular brand. The More is one shoe that a lot of people don't always think of when they think of running shoes. However, this shoe is really, really great and can be great for a lot of people. This is a neutral shoe with stability features. It has a fairly low heel drop at 4 millimeters, but a fairly high stack height, and it's a max cushion shoe. Now, the gait presentation suitable for this would be a minimal to moderate supination at initial contact, especially with the stability features. And it's also going to be minimal to moderate pronation as well. This shoe is going to cater towards a midfoot or forefoot strike with a low heel drop. And what would be suitable here? It would be the peroneal tendinopathy and also patellofemoral pain syndrome. Peroneal tendinopathy primarily because we are going to have some stability here, and we are also going to be keeping our foot in a position that is going to offload that peroneal tendon. Primarily speaking, we are going to be getting away from some of the eversion motion here. The only problem would be if we do have a lack of ankle dorsiflexion, then we potentially could run into problems here because the patient just doesn't have enough range of motion to be able to support that low heel drop of 4 millimeters. Pros and cons: neutral stability. We're going to have increased stress to the ankle and Achilles, decreased stress to the hip and the knee, and we want to be mindful of those high cushion, max cushion shoes. The New Balance 880s, another good shoe. However, there are some aspects of the shoe that might be important to note. It's a neutral shoe, 10 millimeters of heel drop to it. It's also going to have minimal posterior lateral heel bevel as well. And with this shoe, it's going to have gait presentation suitable of minimal to moderate heel strike and minimal pronation as well. Minimal to moderate overstriding would be indicated here as well, because while you do have that high heel drop, you also have a little bit of that posterior lateral heel bevel. So again, you're going to land on the ground a little bit early, and it might help you to limit that overstriding. There's no specific features here that would really cater to specific pathologies, and it's a neutral stability shoe with a moderate amount of heel drop, and it's going to allow for a lot of different running styles. Let's finish out with Saucony here, and the Saucony guides are going to be a neutral shoe with stability features. We're also going to see a moderate heel drop of 6 millimeters, 35 in the front, rear, 28 in the front. It's going to be max cushion, and it's going to have a rocker sole as well. The gait presentations would be a midfoot or forefoot strike. Now this is a little bit on the borderline. 6 millimeters is on the lowish side, but it starts to get towards that moderate aspect. So maybe it's truly a midfoot strike shoe. It's a moderate pronation because of the stability features, along with the moderate supination at initial contact, and some minimal overstriding. With the heel drop being low, it's a concern. However, we do have a higher stack height, so that can promote a little bit earlier of that heel strike or striking the ground. Diagnoses of plantar fasciitis potentially with the stability features and some of the rocker sole. Also, with a limited amount of heel drop, we want to be careful here because we might have a situation where we are really taxing and getting into a lot of dorsiflexion, which could aggravate plantar fasciitis. However, this could potentially be a decent shoe for plantar fasciitis, depending on arch height, stability, and the features of each specific presentation for each case. Tibialis posterior tendinopathy could be indicated here as well. Again, we want to be careful of how much dorsiflexion the patient is doing. And this shoe has good medial and lateral stability. It's also going to have a moderate amount of heel drop on the lower side with that 6, but it does land in that moderate group, and it would offload the stress to the knees and the hips a little bit. Max cushion has its own issues with increased impact, and that rocker does provide good translation from the rear foot to the forefoot for that momentum. So it can be a good shoe, especially if Sauconys are a preferred shoe to be using. And then lastly, we have the Saucony Triumph 21. And it's going to be a neutral shoe. It's also going to have a moderate heel drop of 10, bordering on high heel drop. Pretty high stack height of 37 in the back and 27 in the front. It's very lightweight, so it's a lightweight shoe, which can be really helpful for a lot of people. And it's going to, as I said before, have a high stack height. It's going to be a minimal to moderate heel strike. So in this case, you are going to be suitable with this with the high heel drop, but it's also going to have a fairly high stack height as well. So we don't want too much of a heel strike because that might accentuate it even more. And it's going to be suitable for some minimal to moderate pronation, primarily because we do have a heel drop that's going to have a pronicity and some neutral stability with it that's going to be able to help guide you onto the forefoot. However, we want to be careful here because you can't have too much pronation or else it might be too much for the shoe. We also would say that Achilles tendinopathy could be suitable for the shoe to have that high heel drop. Same with gastrocnemius and soleus strains, and the tibialis posterior tendinopathy could potentially be a good suitable shoe for this. Pros and cons would be a neutral stability shoe, so it does have a neutral stability to it, and that it's very lightweight, which is beneficial for some runners. As we end here, I do want to give a special shout out to our friends at Doctors of Running, and specifically Matthew Klein, who has given us some invaluable data on many of these shoes, their technical aspects. And if you are interested in hearing more from Matt or Doctors of Running, check out my full interview with him. And we go over a lot of different topics. And then the rest here is the resources that you can use and all the different research articles we used when we made this running shoe reference guide. In the meantime, we look forward to seeing you soon. Please let us know if you have any questions, and take care.